Hello, everyone. We're taking away from your siesta, but I believe worth it. Good afternoon, everyone. I'm Ida Saniza Chongson. It's my honor to be your host and moderator for today's session called Digital Contact Tracing, the Emergence of Stay Safe app. Our agenda after the prayer will be welcome remarks by FinTech Alliance Chair Lito Villanueva, followed by the main event, which is around 25-minute presentation of the Stay Safe app by Mr. David Almiro Jr., followed by a 25-minute Q&A panel session to be joined by Mr. Moya. Reminder only that guests are on mute. You can though raise questions by typing Q&A as mentioned. Allow me to start with a prayer. Let's bow our heads. Let's put ourselves in the presence of the Lord. We pray, dear Father, for your guidance and mercy as our world is experiencing great difficulty, a war against this invisible enemy. Give us peace, comfort, wisdom to endure this crisis and follow your will, and that for our people, our country, and all the nations to be united in peace and love. Special prayer to guide our speaker and panel members taking up this important government initiative, which we pray will help contribute to our citizens' welfare. Dear Lord, give us your peace because we cannot do this on our own. This we ask in the mighty name of Jesus. Amen. Okay, again, beautiful afternoon. It's normally siesta time, but we will be having this very important session. To welcome us, we have Philippines' leading and award-winning thought leader on digital transformation and has been cited as one of the top 100 fintech leaders in Asia and dubbed as Mr. Fintech of the Philippines by Bees News Asia. Presently, he's the EVP and Chief Innovation and Inclusion Officer of RCBC, and concurrently as Chief Digital Transformation Advisor of the Yuchenko Group. Please welcome President of BSP's Ignite program and FinTech Alliance co-founder and chairman, Mr. Lito Villanueva.
Thank you, Ida. Good afternoon, everyone. Welcome again to another webinar in our Work from Home Digital Series by the FinTech Alliance.ph. We're back here, still online, and I'm happy to see familiar names joining us today. We have seen lots of ingenious ways of coping up with this pandemic, thanks to digital technologies. Imagine having to go through this crisis without the internet, without our phones and other devices. The digital world has offered us a safe refuge. More than ever, it has become inevitable to live our lives online. But more importantly, the digital tools at our disposal today do not only allow us to live our lives online, but to save lives as well, and ultimately help end this pandemic. This will be the focus of our discussion today, multi-sys service called staysafe.ph. We'll get to know more about this IATF-approved digital contact tracing and social distancing platform this afternoon. This is just one of the many digital bayanihan initiatives we have seen since the start of the ECQ. Together, powered by digital technology, we'll be able to overcome these hard times. Thank you, and please continue supporting our FinTech Alliance webinars.
Okay. Wonderful. Thank you, Lito. Just quickly before introducing our main speaker, we shall be posting, as mentioned, poll questions. I do urge you to please look at this and do answer these questions. Our main event speaker is a full-time technopreneur and a full-stack programmer by heart. He founded Multisys Technologies Corporation, a leading software solutions company in the Philippines that blazes trail across IT, government, healthcare, utilities, hospitality, retail, banking, and finance industries. At present, given the crisis situation, Multisys is considered as a crucial tech provider with its platform being used by both public and private sector. Amidst the COVID-19 pandemic, Maltesers has developed StaySafe.ph, a community-driven contact tracing, health condition reporting, and social distancing. And this, I kind of just want to add on the man of the hour, and because I saw this in a news clipping, possibly the Bill Gates of the Philippines. Let's welcome CEO and President of Multisys Technologies Corp.
All right. So before I will proceed with the presentation of Stay Safe, first I would like to thank FinTech Alliance for promoting the digital bayanihan. So before this lockdown, when this COVID-19 crisis emerged, we're able to develop the staysafe.ph, so that we'll be able to come up with a solution. How could we help the government, the family, the community? So allow me to share the screen for me to present to you the system. Okay. All right. So we developed 4 systems for the Stay Safe. First is the website, which is the www.staysafe.ph. We also developed the Android and iOS. Basically, we're asking now the approval of Google Play and Apple App Store. Hopefully, it will be done this week. We also developed the back-end system of the Stay Safe, so that we'll be able to monitor the worldwide and the nationwide activity of the staysafe.ph. Okay. Currently, we already have 113,000 registrants using the staysafe.ph. So we're able to come up with an integration also with the data of the World Health Organization for us to have a real-time update on the COVID-19, so that you will not monitor only the Philippine cases, COVID-19 cases in the Philippines, but you'll be able also to monitor the worldwide updates. So allow me to present to the staysafe.ph. Before presenting maybe the back end, allow me to show you that the staysafe.ph was approved by AITF and the National Task Force on COVID-19 on April 8th. They signed the memorandum of agreement with Multisys because they see that this will be can be implemented easily in terms of contact tracing and the response system of especially against the COVID-19 cases. So we're able to tap also partnership with hundreds of private companies supporting a digital bayanihan idea. So allow me to present to the staysafe.ph. This is the website. If you register, all you need to do is to have a mobile number. So we don't capture any personal information like first name or last name or birth date or address. We don't capture that. We only need the mobile number. So the same thing. If you use Facebook, you need mobile number. If you upload a certain mobile games in your phone, you need mobile number. Okay. So we also have the terms of conditions, so you can just read that. And then we also added the CAPTCHA for us to make sure that there will be no spammers if they use our website. Okay. So allow me to log in since I'm already logged in. So I'm gonna put my number. Okay. So once you are registered, you can now log in. Once you are inside the Stay Safe system, it's very simple to use. It's easy to use. We intend that way so that even the non-techie Filipinos can use it. Use your mobile number, receive an OTP, then you are registered. Inside it, you can now update your health status. Whether you are in good condition or you're experiencing minor symptoms, you can use Stay Safe. Some of the people is asking us, what if I don't have any symptoms? So it's nice for you to use staysafe.ph because the moment that you declare your condition, whether you are in good condition or bad condition, you are helping actually a heat mapping system surrounding you so that you can notify that in your area, it's safe, okay? The main motive of staysafe.ph is not to capture any basic information. The main motive of staysafe.ph is to capture the health condition. That is the main feature of Stay Safe, not the identity, but the symptoms, whether you are experiencing fever, experiencing dry cough, aches and pains, runny nose, sore throat, shortness of breath, diarrhea, or maybe none of the above of those symptoms. The moment that you filled up those symptoms, we have an artificial intelligence to answer you what to do if you're experiencing such symptoms. Example, if I have a fever, I have dry cough, I have fatigue, I have sore throat. Once you click update, so the system will assess you that you have severe condition. So not to scare people away that you are in a very bad situation, it gives you now a health tips. So it will provide you a health tips, what to do if you're experiencing severe condition. So our artificial intelligence will be the one to tell you that you should self-isolate, you should practice self-isolation and good hygiene, you should use disposable surgical masks, etc., etc., etc. These health tips are not invented by us, but is coming from the Department of Health. So it also gives you several health tips, like if you're experiencing fatigue, it will give you some health tips. If you're experiencing fever, it also gives you health tips. If you're experiencing dry cough, etc., etc. Okay. So the moment that you update your health condition, let's say I'm experiencing fatigue, which is true because we don't have much sleep yet. So if you click update, from severe, it went to mild condition. So again, it will give you another health tips, what you're gonna do if you are having fatigue. So the system is telling me that I have to avoid drinking caffeine, I have to avoid coffee, I have to drink more water and less alcoholic beverages, etc., etc. It also reminds me to wash my hands, maintain social distancing, avoid touching your eyes, nose, mouth, and practice good hygiene. Okay. So the moment that I'll also update it, and I will choose none of the above because if I'm not experiencing any of the symptoms, it will mark me in a good condition. Then there will be no health tips. One of the features of Stay Safe is you can also report the status of your family members, especially those individuals that they don't have any mobile phones. So example, you can report your lolo. Your lolo, maybe he is 8 years old, he's male. So the reason why we're capturing the age, not the birthday, we're capturing the gender, we're only capturing the nickname and alias. So you don't need to disclose your real full name. The reason why we need to capture the age is for us to create a nice analytics. Which age is being frequently infected, okay, by these diseases. Same thing with the gender, so that we'll be able to create an analytics who's being affected, are mostly male or female, okay? So once you declare family members, so you can now create as well like a notification. Every day, the system is reminding you to update your health condition. Every time that you open the mobile app or the website in the morning, it will ask you, how are you doing today? So once you click, I'm not feeling well, the system will require you again to enter again your health conditions, okay? One of the features of Stay Safe is you can also view real-time the updates of the COVID-19 status in the Philippines. So you can see that currently we have 6,000 confirmed cases, we have 572 recovered, we have 409 deaths, etc., etc. So we even created a dynamic system. So meaning before they're using PUI or PUM word, but since we developed Stay Safe in a dynamic platform, we're able to change the PUI into probable and then the PUM into suspect immediately. So currently we have 1,400 probable and we have 6,321 suspect. We also update this in a mapping system. So later on, I will show you also a general mapping that we're able to connect the data of the World Health Organization so that we are aware also what's going on in other countries, not only in the Philippines. So if you click the US, so here are the COVID-19 status. If you click France, if you click Spain, if you click the Philippines, etc., etc. Okay, we're able also to create a 3D mapping, okay, of the analytics coming from the World Health Organization. So you can play with the globe, so that just in case that you have some family abroad, so at least you know what's going on in that country. Okay. All right. Okay. So one of the features also of Stay Safe is we have the I Want to Help button. In fact, tonight we'll be launching more features of the Stay Safe I Want to Help button because we receive a lot of suggestions that we should include a more sophisticated donation, whether it's good or cash. So we embed that last night, but we plan to make that feature up tonight. So if you are a frontliner, if you're a nurse, if you're a doctor, in fact, one of the feature of Stay Safe is you can also give free consultation to the nearby affected individuals. So if they have fever, if they have cough, at least someone is calling them, comforting them or telling them what to do in a free way. So if you want to donate goods, if you want to donate cash, or if you have other suggestions, so you can use also that I want to help feature of Stay Safe. Inside the Stay Safe, you can also capture a picture, but this is optional. So it's up to you if you would like to change your profile. So it's up to you. You can also put your city or municipality so that the LGU will be able to know your location. Okay, not on the barangay level, not on the street level, but you're only telling that I am from City of Parañaque, I am from City of Manila. So you are not actually declaring your exact address. You can also put your organization or company. In fact, one of the features of Stay Safe is your company can ask free access from us, and then we can give them access so that each company will be able also to monitor their employees only. So they cannot check the data of other individuals or other company. They can only see the health condition of their own employee only. Okay, so let me jump to the admin panel. So there you go. So this is the admin panel. Once you enter the admin panel, currently we already have 113,000 registrants already. So these are the in good condition, the mild condition. Currently we have 175 severe condition. Okay, so in the map, so you can see color codings. The green ones are actually the individuals that are not experiencing any symptoms, so they are in good condition. The orange ones, these are the individual that experiencing minor symptoms. The red ones, the jumping red pointers or buttons here, these are the individuals experiencing severe symptoms. Okay. One of the features of Stay Safe is it has a GPS mapping, not on the individual because we don't capture any information. We don't know who they are. We don't know who they are, but we know that in that location, we know that there are sicknesses there. They're experiencing fever or fatigue or sore throat or any of the possible symptoms of COVID-19. One of the features of Stay Safe is the heat mapping system. Okay, so once you click heat map, the system can analyze the whole map, and then it will identify places. What are the places that are suffering some kind of symptoms equivalent to the COVID-19 symptoms, so that the government or the LGU will be able to target that location, target that place to do testing. Because it's really hard to do randomized testing nowadays, especially we don't have that much in terms of COVID-19 testing kits. So it's nice to help the government to identify that in this area, there are accumulation of symptoms, okay, possibly COVID-19 symptoms, okay. One of the features of the system is you can click mild symptoms so that you'll be able to see the mild symptoms only. You see, these are the heat mapping of the mild symptoms. You can also click severe so that you'll be able to identify which area, okay, are suffering from COVID-19 symptoms. So now you can see that it's targeted. So you can see part of the Ortigas area, part of the West Crame area, San Juan area. So at least we know that these are the severe cases reported by individuals. And this is also reported by hospitals. The intention of Stay Safe is not only individuals, because we let the hospitals or the IATF to encode also those suspected COVID-19 cases and even the probable cases, so that it creates a contact tracing, okay? So allow me to show you the contact tracing, okay? So on the contact tracing side, I will click the contact tracing simulator. So this is the view of the contact tracing of the staysafe.ph. The moment that you are approaching or you are being contacted or to a certain PUI or PUM, so the system creates links immediately so that we know that this person is with a certain individual that has COVID-19, or maybe experiencing the same symptom of the COVID-19. Okay, so the idea of the contact tracing, actually we copied the contact tracing of Singapore, and we also embed the contact tracing system also of Taiwan and South Korea. So this is not actually an original idea of multi-SIS, but what we have done, we enhance it, because the biggest problem in a certain mobile to mobile is 1:1. So we develop a system that could do 1:many, meaning you can report your condition and you can also report the condition of your family. Okay, so let me go to the simulator. Okay, in the simulator side, in fact, you can check the try contact tracing. So if you're using a laptop or desktop, you can click this. It's called try contact tracing simulator. So once you click this, so you can simulate it. So you can see these are houses, residential houses. So this is a hospital. Maybe this is another hospital, or this is maybe a government establishment. So people are going out, right? So once they go out, that's why the government implemented the ECQ, because this is what's going on. Every time that they go out and a certain individual will also go out and meet them outside, the system is creating a certain link to them. So even they will go back, they are now infected. And even this person will go back again to his house, it can again affect another individual. Okay? So let's say this suspect, he went to the public places. Maybe he went to the market or mall or to any public places. So it creates links. So every time that's creating links and links and links and links. So this is the danger of the virus COVID-19 or the pandemic of the COVID-19, because we cannot see it, but the transmission of the virus is easy, That's why the government implemented the ECQ. Some people don't understand why they are inside their house, because we are the one who's moving the virus. The virus is not actually moving. We are the one moving it. If you click, let me try to click simulator here, example, links. So this is now the contact tracing module. So by just one person, it affects multiple person immediately. So imagine how many people that single person affected, and that another person also affected another person, and that person also affected another person. So the beauty of the contact tracing module of Stay Safe is to break that transmission. The only way to do that is we should avoid creating links to individuals, especially to the person or identified COVID-19 cases. Okay, so let me try simulation 2. Okay, this is what happened. Okay, so if this is confirmed COVID-19, every time that it touches a person, it creates a link. Okay, it creates a link. Okay, and if this person, that's the one that he touches, if he will go to another individual, and this individual will touch another individual, and then this individual will touch another individual, now you're creating now a non-stop link. So we cannot stop the transmission of the virus. Okay, that's why we support the ECQ of the government. This is the only way for us to stop the transmission of the virus. We should stop moving. Okay, of course, there are people that we need to, like on the quarantine pass. The system also of Stay Safe can issue also quarantine pass, so that we'll be able to still get food, buy food from the supermarket, etc. But it will give also a notification that you should keep distance even inside your home. Okay, so let me close the contact tracing. I'm sure if you have other questions later on about the contact tracing. Again, the contact tracing is not on identity, because we don't know who they are. What we know is these are individuals that they declared their own health condition. So Stay Safe is based on health condition, not based on identity, right? So let me go back here, the admin panel. So one of the feature also of the contact tracing is to create a targeted individual, so that the LGUs will be the one to call these people. They don't know, but they can call. They can ask how their place, and then the LGU can go there and do also the testing of the COVID-19 testing kits. So that's one of the advantages also of the stay safe. Okay. If you go to the data source as well, so it gathers automatic information or coming from the WHO. So we don't need to enter every day here because it's an automated one. So all the cities in the world and even all the countries in the world. So this is updated real time, okay, coming from the World Health Organization. That's why we're able to create a COVID-19 status, okay? In the COVID-19 status, it analyzes every country. It also gives you trends, the case trends, the age trends, which age is being infected, the location, the case mapping. So you see we're having, US is being affected, and this area, Spain, Italy, et cetera, et cetera. You see Philippines is now being noticed here. There's a huge red dot already here. Okay, so if you click the heat map, 10 days ago, we did not see any green heat mapping in the Philippines. But right at this moment, we can see that there's already an accumulation in the Philippines. So to be honest, if we will not promote the contact tracing, I think it's really hard for us to stop the transmission of the virus. Okay. One of the features also I presented to you a while ago about the mapping. Okay, worldwide registrants. On the registrant side, so let me show you the contact tracing activity. Let's say Young, because I did not disclose my name, so I only disclose my code name. So look, the location here is not the exact location of the individual actually, because it has a 200-meter radius. Take note, GPS is not accurate, so meaning it doesn't target your exact location. Another one is you can declare your family members, and then it creates a history. Okay, so every time that you're declaring whether you are in good condition or severe condition, it creates a heat mapping to you, so that it will create alarm the moment that a certain individual will go near to you. It doesn't scare you away, but it will send you an SMS message, a very nice message telling you to stay home, so that we don't want to create like commotion that you might run away, So the biggest way to make people not to have that panic or alert is like to receive a message that, hey, you have to stay home because like 300 meters away, there is a possible coronavirus patient or coronavirus infected person, okay? So that's the main feature of the contact tracing, okay? Another one is the content management. On the content management, we're able also to attach our AI, our artificial intelligence. In fact, once our mobile app, the iOS, Android, and Android will be up this week, you can find so many features there. We even embed a multibot. Our multibot is a chatbot. We also embed more health tips coming from our artificial intelligence, whether if you have diarrhea, you have dry cough, you have fatigue, you have fever, you have runny nose, the system will be the one to give you health tips. The system also creates a company management system. That's why we are enticing private companies to contact us. We're willing to give you access so that you can use Stay Safe to manage the health condition of your employees only, so that you can also know their health condition, whether they're in severe or mild or in good health. Case management system is also here. And at the same time, we have the access control. The access control, we already give several LGUs. So example, we give access to the City of Manila. The City of Manila can access only the City of Manila. They cannot access other LGUs. We also give access to Pasig, so they can also access the Pasig area. We also give the access of, let's say, Isabela, Gamu Isabela, Ilagan Isabela, Luna Isabela, Malabon, Nueva Vizcaya, Parañaque, etc., etc. So the system is actually in a location base, meaning if you are an LGU, you can only take good care of your own jurisdiction. So you cannot actually see the other LGUs. So that's how the control, the admin control. That's why we're enticing LGU. I think the DLLG, they will be contacting all the LGUs next week. They will be distributing free access to all LGUs. Okay, so that's the StaySafe.ph. Okay, I forgot. Since we captured mobile number and we don't even know who they are, consultations and the responders or the LGU respond team, they can actually click the red ones. Once they click the red ones, they'll be able to call them. Of course, they don't know who they are, but they can call them, ask them how are they doing, and then they can send help Maybe they can send an ambulance already because it's already crucial. Maybe they can call or ask them to stay at home, or maybe send financial assistance, or maybe medical assistance, etc., etc. So the StaySafe.ph, if may I show you the PowerPoint presentation. So I hope you're seeing this. Let me go back here real quick. Okay. One of the features also of the admin panel of StaySafe is the social distancing system. So it could also analyze the location where individuals are actually gathering, because the biggest problem is, there's a lot of crowd. Sometimes you go in the crowd, and it creates now how many people you're able to contact to. It creates that. So it creates also alarm that today I contacted 10 people. Maybe today I contacted 100 people. So that people will understand the beauty of StaySafe, that you should stay home and avoid contacting so many people. So that's one of the features of StaySafe. Okay. So let me go to the PowerPoint presentation before I'll end my my presentation. I hope it's clear. I did not present the other technical details because it's more on the operation of the AITF and the National Task Force of COVID-19. Okay, so the StaySafe.ph comes with website and mobile apps. Hopefully this week, the Apple Store and Google Play, they'll be able to approve the uploading of our mobile app. Okay, so actually StaySafe is a digital bayanihan. We all know that the government cannot do this alone. It should be every citizen should be able to contribute, okay, and tell to the government that this is my situation, this is my health condition, so that the government will be able to identify targeted individuals to assist, targeted individuals to give support, maybe financial, or maybe health, or maybe medical. Okay, right. So these are the features. First, it has a quick and easy integration, so you can try it. It's very easy to use. It has a health condition reporting system. It has a COVID-19 contact tracing system. It has a hit and case management and mapping system. It has a social distancing notification and alarm. It has a company and LGU response system. It has a COVID-19 case data entry and monitoring, meaning the LGUs can enter their suspected or confirmed cases in the system, so that the data of StaySafe and the data of the government will be able to merge, so that it creates a nice unified contact tracing. It has a hospital and frontliner monitoring system. In fact, we prepared StaySafe to protect also our frontliner, so that we know how many they're contacting every day, so that we can be able to show support also to our frontliners. It has an SMS blaster. I'm sure some of you receive an SMS blast from StaySafe. So this blaster can send notification or alarm to individuals, especially to the area that there are suspected individuals in that area, to give you notification. It has a track and trace modules, alarms and notification. It has a centralized admin access and analytics. And it has a COVID-19 worldwide updates. Of course, we added the health tips and reminders. Okay, so that's it. So this is the digital bayanihan platform. This is the StaySafe.ph, easy registration, health condition monitoring, health tips and online consultation, contact tracing, super admin and admin panel, a company admin, local government admin, the national government admin, which is being managed by National Task Force on COVID-19 and IATF, the general dashboards, contact tracing, heat mapping, monitoring, community-driven contact tracing, LGU access. There you go. So that is the StaySafe.ph. So this is the access that we installed to National Task Force in COVID-19. Okay, so we're able to launch already this starting April 8, 2020, of course. Right, that's it. So if you have any questions, we're willing to answer them. There you go. So that's StaySafe.ph.
Thank you so much, David. I'll call you Dave because I know you more on Dave. Okay. Oops, okay. Sorry, I just got muted. Thank you so much, Dave. There's a lot of information there. And I've actually noticed we have a total of 35 questions, but I noticed some of the questions you've answered, like whose jurisdiction, who's in charge of it. But before going through the panel discussions, please let's welcome back Lito. And to join Dave and Lito is Mr. Richard Bonmoya. His comprehensive experience in public sector includes 5 years of involvement in crafting and executing the National Expenditure Program, as well as leadership roles in reforming public finance, government reorganization, and systems improvement. He has extensive capability in the utilization and integration of new and emerging technologies to produce cost-effective time. He has also been doing pioneering activities in the Philippines e-commerce. To date, he is part of the Management Committee on Knowledge Management Systems. Let's welcome Microsoft Philippines National Tech Officer, Mr. Bon Moya.
Good afternoon, everyone.
Hello. So Lito, are you there?
Yes, yes. Hi. Thank you, Dave.
Lito.
Yes.
Okay, we have really tons of questions, 37 now. And going through this, I noticed a lot of the questions being answered by presentation. Let me start with some interesting and just a quick one. And most of the questions are actually for Dave. So starting with, what's the difference between surveillance and contact tracing in your app?
Actually, this is not a surveillance because there's no identity, you know. So it's more on the health surveillance, maybe. So more on the health condition surveillance, because what you're declaring is not your identity. What you're declaring is your health condition. So you are declaring if you have fatigue, if you have a sore throat, if you have fever. So that's the one that being recorded in Stay Safe, not the identity.
Okay, this is an interesting one, and I'd like to get the view first of Bon and then Lito. How will the adaptation of the app be fast-tracked to gather reliable and sufficient information for decision-making? Kenneth, can we have the poll on this one? This is kind of similar to our poll, the last poll, if we can bring it up. But at the same time, okay, let me repeat the question. How will the adaptation of the app be fast-tracked to gather reliable and sufficient information for decision-making?
Hello, Ida. I think I lost
Hello.
you.
Hello.
Lito, were you able
Yes,
to
yes.
hear the question?
Yeah. I can hear the question. I heard the question. Yeah.
Yeah. Let me
turned off my
first
mic.
answer
Is this
that,
better?
Ida. So
Okay.
let me answer that question. Okay, but before Lito and Bon answer it. So of course, it's all about trust. We're receiving a lot of good comments, tons of good comments. Appreciates of what we do, but we also receive some doubts. About how we're gonna use this. Is it secured? Is it cybersecurity secured? Is it comply with data privacy, etc., etc. The only way to fast track this is we need to trust StaySafe.ph. Since this is not about identity, this is about the health condition. So to fast track I think the government already announced about StaySafe.ph, but again, it's all about us, helping each other. We should be, each one of us, every Filipino should understand that StaySafe.ph is actually on the health condition reporting for us to help the government, not on the identity. Okay, so more likely that's the one that we should do. We should build trust first.
Yes, I think just to add to what
Okay.
sorry. Yeah, just to add to what Dave said, no, in relation to the question posed by Ida, I think for us to be able to see some traction and to make it successful, aside from trust, I think one of the things that we need to also push would be the public's understanding or awareness or education about the relevance and the significance of this initiative. No, so I think beyond, of course, there are some concerns, valid concerns pertaining to privacy, to a lot of things, security, etc. But I think it was already vetted by the task force. No, these are comprised of various government agencies, and in terms of in terms of security, in terms of safety, etc. I think as far as I know, it was also vetted by the National Privacy Commission. So I think aside from trust, I think one of the things that we have to put premium on would be really on education, on awareness. No, so to make sure that the public, especially those in most vulnerable sectors of our society, be able to understand the importance or the benefit of this one, especially now that the government is still in the process of determining whether we will have a modified ECQ or whatever action that they may have after April 30. Bon?
There we go. Sorry, apologies, no commute. I think David mentioned one of three elements that I think is important to highlight. The first one is trust. We, as a society, community, need to realize that this would have to be our app. If we don't recognize it as a community app, then it probably will not work. So we have to adopt that attitude. The second one, I think, is so trust is one. The second one is enforcement. I think we have to build in mechanisms so that there would be enforcement because in any society, hindi naman homogeneous ang compliance. So we as a and that's not just government's role. I think everyone will have to come in and weigh in, just like what we do in quarantine, that everyone will have to participate. And then the last item is that because of time, I don't think there will be any system that anyone can build, no matter how much resource at this point in time, that will address everything. So I think it's not that we need to be impressed by the system to make it work, but rather as a community, we should all collectively make the system work and not exploit it and find the limits of the system. In fact, that's the only item, that's the only activity I think that will make sure that more information will go inside the system and that those information will become more relevant to more people, just like we do with Waze. Ang tawag nila dyan, parang community data gathering. So we have to view it that way. If we don't, and we just see it as a system by IATF or a system by multisys, likely the efficacy of the system will be limited.
Yeah.
Yeah, but is there any talks, Dave, that the government will in fact maybe make this mandatory, which is one of our poll questions, by the way?
We leave that to them. For us, we're just being guided by IATF, so we don't want to speak in behalf of them. So when we develop Stay Safe, because take note that Stay Safe is not easy to create, because we have an existing system last year called the HealthBox platform. So this HealthBox platform is not actually for COVID-19, to be honest. This is actually developed for dengue monitoring system, for N1H1, for malaria, for tuberculosis. So we enhanced that and revised that and modified that to become the Stay Safe. Okay, so we presented that to a national task force on COVID-19. So they accepted that. We signed the MOA. So on that question, Ida, we will follow their lead.
I think Ida, I think I have a point to raise here. I think especially that most of our Filipinos now are very much concerned about the current condition, especially on the ECQ status and how it would progress beyond April 30. I think we all have to agree that government is in a way has difficulty trying to trace the hotspots of where the virus is, right? So I think if you don't have a tool, if a government does not have a tool by which they could be able to determine those hotspots, then I think this ECQ will continue on, right? But if everybody, the whole community, I mean, through the help of LGUs, and everybody would support this and be able to trace everybody, then we will now be able to isolate those that are classified as severe or mild with mild condition, etc. And so that the others who do not have that health condition may now go back to work. I mean, may now go back to regular, ways of doing things prior to ECQ. Because right now, if everybody is blind as to where it is, as to where those hotspots are, then I don't think government would be guided guided carefully or scientifically or data driven decision in terms of them having to decide on whether to lift the ECQ or will there be any modified ECQ beyond April 3rd.
Yeah.
Okay.
And
There are a lot of I'm sorry. Go ahead, Dave.
sorry, Ida. One more thing, just to because I would like to speak like a Filipino, so consider us that like not the one who developed this StaySafe.ph. So if you trust Facebook, if you trust Waze, if you trust Instagram, where you also declare your mobile number there, in fact, they are more gathering more information, to be honest, than Stay Safe, right? So if you trust this foreign technology, and I think we could also trust StaySafe.ph. So I think this is not the first time to implement this, by the way. This is being done by Singapore, this is being done by South Korea, this is being done by
Taiwan.
Taiwan. They even mandate this. In fact, if you go to Taiwan now,
Mandatory for
if you go
Taiwan.
to Taiwan, you are not allowed to enter the country without using their contact tracing because they have to monitor you. Like you have to have 14 days self-quarantine, before you can go out. In fact, it's even like crucial if you are identified as a COVID-19 suspect. If you go out, you will go to jail because it's your duty to protect your community. You should stay home, especially you are already suspected to have the COVID-19, right? So for me, it's not something that we are the first one who did it. So we are just actually implementing something that's being done as a best practice of other successful country who actually somehow successful, battling the COVID-19, right? So that's the one that I would like to add, Ida. Thank you.
Okay, and I still hope you can hear me because sometimes my signal's changing. I'm compiling 3 questions into one, and it's basically for the consumer itself, the user. For example, you're in a public transportation or in a room, and could you actually access that the person next to you is on a critical condition? That's one, which is, by the way, as I said, I'm compiling this. What happens to the labor-intensive operation? And can you actually tag someone looking sick? If that person's not reporting, could you report the person next to you is actually not feeling well?
Yes, it may answer that question. So on the first question that about like notification, if there are nearby possible COVID-19, it has an alarm, but it's a very nice non-invasive alarm. It will just notify you to stay home. It will tell you that there are possible because we don't want to point the location, or because to be honest, we don't even know the location because GPS is like a 300 or 200 meter radius, so it doesn't point you on the exact location. Me, I checked my location a while ago, but my location is like 500 meters from my real location, so it's not accurate. So it will just tell you that you are near a certain COVID-19 case. On the second question about how you're gonna use the system in extensive labor. I'm checking the question here. Ida, can you repeat the next question about the labor thing?
Oh, a labor-intensive operation. How do you tackle that? In a manufacturing company, you're all kind of like less than the social distancing. I think that's a question more on whether they will be allowed to open if they don't follow the requirement by the social distancing, so to
Yes.
speak. No?
Actually, stay
But
safe.
is there any way that, it could?
Actually, Stay Safe is a social distancing platform. So meaning if you are like a manufacturing worker, because you have to still, especially after the COVID-19. So even if you go to a certain place, let's say you are a manufacturing worker, at least you know that in your crowd, there are no infected person there. So it's something that it make you feel safer, So once you have the Stay Safe app, it makes you feel safer because you know that surrounding you there are no COVID-19 patient, and then if someone will be near you, of course the crowd will be notified. So I think stay safe can be a tool also, especially you are in a labor extensive environment. It could help you feel that you are fine, you are okay. So I think that's one of the advantages of stay safe. It might not be perfect, but at least it will give you a hint that it will give you the peace of mind, right? That, hey, I'm okay. Even I am with 50 people here, but if I check stay safe and, there are no COVID-19 patients or COVID-19 cases surrounding us, all right?
Yeah, I think just to add to what Dave said, no, Ida and Bon, I think we commend Dave and Multisys for being able to contribute to the country in terms of trying to find solutions in addressing this crisis. No, we were caught off guard. We all know that, and this is not something that is only limited to the Philippines, but globally, right? So I think after Dave or Multisys have provided this platform, I think it is now up to the government, with the help of the private sector, to really promote the use of this platform, because again, it is something that we need to do. As what Dave said, no, a while ago, if the public trust Facebook, Instagram, Twitter, and also social media or digital platforms out there, I think this is something that would really save lives and be able to contribute to the protection of in terms of public health and public safety. So I think paramount to this is really as what Dave said, no, this is bayanihan that has to be supported by everyone, not just the push from government, but also by the local government units, the communities in all locations nationwide.
If I may add also,
Okay, there are yeah, go ahead,
I think
Bon.
there are many data points that input. One of that data input is the individual to add to the collective. It's also important that the hospitals and DOH will also now, those who are confirmed, put them in the system, even if the people who are not there, because we have other data sources, did not use the stay safe. I think that's very important because if everyone is affirmed that they know that at the very minimum the location of the active COVID is there, then everyone can sign up because they would want to have access to that information. Their location, not the individual, the location of the individual.
Yeah.
The stay safe is basically using your mobile phone. Two questions here. Can you actually say someone beside you is sick, like a whistleblower? And at the same time, do you really have to use the phone or could you use another device?
Yes, actually, the Stay Safe is developed or implemented into one-to-many. In Singapore, it should be one-to-one because they use the Bluetooth. Although Stay Safe mobile app, it has also the Bluetooth integration that we implemented as well. So we have two things, okay? So we have the Bluetooth and we have the GPS. But what we've done is one-to-many. So example, if you're Lolo or Lola, the one I presented a while ago, so you can also report their health condition. But the moment that you report someone, okay, the LGU can call you to verify about it because we don't want someone like reporting reporting false statements, right? Maybe reporting 100 PUI and PUM in this area. So meaning you are actually liable on the family that you're reporting. So you have to make sure that you are telling the truth, because it doesn't give you any good if you report someone sick beside you, because the LGU will call you, to give you assistance, to give you help, to give you medical consultation, right? So a simple question of like reporting someone that they don't have any mobile device. So you can still stay safe. Like your children, let's say you have a 8 years old child or
Okay.
6 years old child, so you can still use stay safe to report.
Okay. There are a lot of questions here. I purposely did not turn on my cam so you guys can hear me because it's slowing me down. There's a lot of questions regarding the integrity, the security of the data. I know you've kind of semi-answered this, Dave. But, the security of the data, who really is in control? Is it the national government, the LGUs? Do they share information? a lot of the, as I said, questions are more into the data privacy and specifically, what are the security controls being implemented by the app for the security of data, and who is the ultimate person responsible for the data?
We are in talks now with the ICT because we're having a lot of meetings with the ICT because we don't want to hold the data, because for the moment it's a private who's willing to help the government. That's why when we presented this to the National Task Force and to IATF, so some of them, actually most of them, recommended that it should be the government who's going to manage this. That's why DICT, we are talking to them. They are preparing already their data centers. They are actually preparing the cloud service that they're going to use. So this will be maintained by the government, not by us.
Okay. We're just beyond our schedule, but let's give another 5 minutes, if I may. Can we please look at the poll? It says here in the data privacy, majority of them are actually looking at giving the information, while still 11% are saying no. But when it comes to the medical guidance, which is quite interesting, 23% coming from DOH, 16 coming from social media or friends, and really 13.2% they don't know, but they will search. What can you, and this is for Dave, what can you say about the power of the Stay Safe app in terms of giving or having access to medical guidance and information?
Actually, we can really enhance this. In fact, we're asking also the help of the healthcare businesses to really guide us also, because we developed the system in a dynamic mode, meaning you can easily add a lot of medical guidance there, consultations or health tips. So we are also in talk with some hospitals and healthcare businesses to also add more features, since it's a AI. So we can easily add more features on the health consultation.
Okay. There's a question, not in the poll, but there's a question here, and I understand. This is for Bon and this is for Lito.
Yeah.
How do you think the organization, the tech industry, the fintech industry, can stop the spread? And there's a question coming from the field health officer. Best in terms of financial management at this time, which is really not the Stay Safe.
Okay, I think on the fintech industry, on how the fintech world would help promote this particular platform. I think I've shared this with some of our colleagues in terms of us being able to really be part of the education and awareness campaign, and by way of us putting or maybe just mentioning or just including the link of staysafe.ph in all of their mobile apps, for example. Say, for example, Gcash, Paymaya, Coins.ph, Grab, etc. So we have all of the members of fintech companies who are members of the alliance. So I think we'll be able to encourage them and try to request them to also support this initiative, because of course Multisys, while Multisys is also a member of the alliance, this is again beyond our industry, because this is something of national concern. So I think this is a again everybody is expected to support and help each other stem the spread of the virus.
Okay, Ida, I think dito already addressed yung what immediate help we can do. It's just really to propagate among our communities and encourage them to do so, because the more we do that, the more the system, I guess, builds more data and it becomes a bit more trusted. My point that I just want to bring up is that this is really an innovation induced by a crisis. In truth, we are actually prone to other crisis type, not just COVID. Other types of virus, flooding, earthquake, taal, all those things. So I think if this works out, I think, and God willing, in the next few days, mag-flatten na siya and we won't use it, we should continue to innovate and use a platform that moving forward will help us with any types of similar types of crisis.
Yeah,
True.
so this is not the end of it.
Yes.
Just to, Sir, if I can, this is going to be the last because we really have to close already. Wish list for Philippines' sake. Wish list to ensure that, because contact tracing is so important, it's one of the top 6 mentioned by WHO. So your wish list to make sure that this will work, starting from Bon, Lito, and then finally Dave.
Oh,
Last words, so to
all
speak,
right.
yes.
Well, it will not work if we won't use it. I think clearly. So the wish list is that everyone, not government as the lead, the public sector as a big support adapter, must collectively make it work. Otherwise, it won't work.
Yes, for me, again, the ultimate measure of success on this platform will hinge on the mandatory requirement by the government to ensure that everybody would be downloading this or would be using it, because will be the ultimate um, basis for them to have an informed decision in terms of how to go through the process of fighting this COVID-19.
Yeah.
And David?
So yes, of course. This is a digital bayanihan. Meaning we are fighting our own enemy here. So this is no longer about the government. This is no longer about an individual. I think for this kind of crisis, we need to remove or maybe forget for the moment our differences. I am sure there's a lot of trying to take a hole and perforate and try to get a certain negativity of what we do. But me myself as the CEO of Multiseas, my people, they work hard with this one, and their passion to really help the country. They're with 7 sleepless nights just to develop this. Their only wish is like, we should help each other. We should combine our mindset, our our purpose, okay, to and our mission to stop this COVID-19. But at the end of the day, we are all affected here. At the end of the day, so I think if not only the government will be the one to join force with the one, they're doing their best. Our government is doing their best. The community should join force. The family should join force. The individual should join force. I think this is the one that I think it's the right time and right moment that all Filipinos should be able to unite with this one goal, to move forward, to fight back and beat this COVID-19. So we can do this if we are together.
Okay, thank you so much, everyone. Thank you so much, everyone. We do need to do this, the trace, the test, and the treat. It's important for us to have the transmission controlled and very important to have detection, isolation. And just to, as a final word, we do need to heal as one. So thank you so much for attending this webinar. The other questions, we'll try to answer that through FinTech Alliance.
Yeah.
And last words coming from our president, from our chair.
Again, thank you so much, Ida. Thank you to our speaker, Dave, and our co-panelist, Bon, for a very fruitful and productive discussion. And of course, expect for succeeding webinars that we will be sponsoring through our FinTech Alliance. So thank you so much and good afternoon to all.
Bye, everyone.
Thank you.
Thank you so much. Bye,
Thank you.
everyone.